Hey everybody, Dr. Mack here. I just finished a 3-day seminar on concussions and just kind of wanted to share some things that we learned this weekend. We did a ton of research, reading of research, evaluating research, and all of the concussion research points back to what we're doing at Portland Chiropractic Neurology, which is really exciting. We try to be very, very evidence-based, and there's different levels of evidence-based. There's levels, 1, 2, 3, and so on. There's, A, B, and C levels of research, which are, validity and strong evidence versus moderate evidence versus weaker evidence. It doesn't mean that they're not good, that they're not a good treatment. It just means there hasn't been as many studies on them yet, and more information is needed. But Dr. Carrick is my instructor, and he's a really genius guy with treatments and world-renowned, and has amazing things to share. So we were able to look at kind of what we're doing, and as it relates to, is it the best thing for patients? And what we were able to find is that some of the best researched things after concussion for patients are, when I don't want to say surprisingly, but really excitingly, cervical rehabilitation, the neck, right? So cervical rehabilitation is shown to be a very important aspect of treatment after concussions. So chiropractic care, physical therapy, rehab, all of the rehab that we do for the neck is an integral part of what we do with concussions eventually. But that also would translate into the thoracic and the ribs, oxygenation, those types of things. Another aspect is the vestibular rehabilitation, which is what, if you're a patient or not a patient, if you're a patient, you'll understand that's a lot of the eye movements that we do, the repositioning maneuvers. It's kind of a, vestibular rehabilitation is kind of a catch-all term for, vestibular ocular activity, things that use eye movements, neck movements, vestibular balance coordination, and kind of bring them all together. The other thing is that light or aerobic exercise is really important for rehabilitation after concussion, and can increase efficacy of treatments. And so, just walking is really important. Aerobic means to stay within your oxygenated levels of muscles in your brain when you're doing activities. This is why we do so much with autonomics with our patients. The autonomic nervous system delivers blood flow or oxygen to different regions of your body, specifically your brain, of course, with the concussion, which is extremely important because a lot of people can be doing activities and draining draining the metabolism, if you will, or their functional capacity and their reserve of these different parts of the brain that then go through a process which is not so healthy and helpful for people, or they fatigue and they become weaker in these areas of the brain. But if we can increase oxygenation and blood flow to these regions of the brain while we're using them, and monitor these things and understand how to maximize that, then patients recover much faster. So this is what the research shows. This is what we do in our practice. This is what is important for people to get better. So when you combine those things, which is the exciting part, right? Cervical rehab, the vestibular rehabilitation, autonomic rehabilitation, increasing oxygenation, all of these things, exercise, the aerobic activity, all of these things that are well researched and have strong evidence to support are what we're doing in our treatments. And one of the really cool things behind what is very clear is that a multimodal approach, or combining different therapies, is the key and the best gaining the best results for concussion patients. And this isn't just for concussion patients. This is for back pain. This is for neck pain. It's for any kind of vestibular migraine type of aspect that occurs after concussions, or separately from concussions. But what we do see is that people's gait changes, their posturing changes, so they do develop back pain, knee pain, injuries, ankle, injuries, shoulder injuries because of this posturing and gait changes, meaning walking and how we impact the ground, how we move, the kinesthetic forces that come through our body and abnormally after when we're not moving appropriately. So the injuries are increased. Actually, one of the research showed that ACL injuries are more prominent after concussions because of coordination and gait and different loading of muscle groups and those types of things. And we look at some of the major symptoms that people feel after concussions. You look at headaches and dizziness, imbalance, those types of aspects. You look at cognitive fatigue, mood changes, all kinds of other symptoms like reading difficulties, migraines, irritability, focus, executive function, all these different pieces, photophobia, phonophobia, all these different things that people experience after concussions. And so when we look at these things, we have to also diagnose them from the same way that the research is showing the treatment, which is looking at different regions that could be affected, right? A multimodal approach, looking at different aspects of a person's physiology, meaning their visual system, their vestibular balance systems, their proprioceptive information, which is information from their body to the brain, autonomic systems, right, and regulations. So it's really important. And what we do at our practice is that we evaluate all those different things and see how they incorporate into the concussion or the post-concussion syndrome or the persistent post-concussion syndrome. Some of these terms you hear, that a lot of people have concussion and after a few weeks they're doing okay. It depends on their functional capacity. Are they Olympic level athlete, or are they the rest of us, like I've been a couch potato lately? So where are they on that level? And it depends on how fast they recover. But there are a percentage of people that just don't recover very well and maintain symptoms, and that's your post-concussion syndrome or your persistent post-concussion syndrome. So we have to be able to evaluate these things and develop an individualized, appropriate treatment, which is multimodal. And many of these individuals, when they have these errors within the brain from the concussion and the axonal stretching and tearing, and injury to the brain tissue, white matter, gray matter interfaces, those types of things, we have to make sure we look at their sensory information coming in, because they get what's called a mismatch. And so this mismatch creates symptoms. And when we look at treating patients, we have to be careful, and everyone should be careful of treating one system that can be upregulated or increased activity and make a patient feel better. But by increasing activity in one system, let's say it's the vestibular system, but forgetting about the neck, then the brain is relying on all the vestibular information, your inner ear, or maybe your visual system, and not using enough from your neck. So you may still get headaches, or you may still get different aspects. And if one of these systems becomes affected or injured, then you're relying totally on that system. This other system that hasn't been utilized is no longer giving the brain the right information, and you get tremendously terrible symptoms. So when we look at the brain, we have to understand that it's redundant. There's usually more than one bit of information that comes in through the brain to the brain to give it information on the area. Like for our balance, for instance, information from our vestibular system and from our proprioceptive system both go through the same area of your thalamus, which is the gatekeeper to your brain, meaning that the brain uses both of those to understand where we are in space. So you don't want a lot of information from one and not much from the other. You really want a nice balance, so that if one system becomes a little bit problematic, you hurt your neck, you don't automatically get very super dizzy, which can happen with people. So a lot of people that we see. So it is very important that when we look at all these different systems of the brain and break them up into different areas, brainstem, cerebellum, vestibular, cortex, all these different regions, that we're balancing these. So not only short term, but long term. And so that's just really important to understand and fun to treat, because a lot of people do a really good job with, let's say vestibular rehab, or let's say proprioceptive, or, PT, chiropractic, or migraines, but they aren't able to integrate all the information in a full encompassing understanding and diagnostic and treatment program for the patient. So it's very important that as practitioners and that we do that, and as patients that you understand that you get a full realm and full treatment aspect for your condition. That's what we try to do at Portland Chiropractic Neurology. That's our goal. And to know that our colleagues upstairs, Brandon at Portland Physical Therapy, they do a very similar thing. So really great to understand that and to review that and to see how much information and support there is in research for what we do, which is really exciting and fun to review. Read hundreds of research papers. It's fun for me. But thank you for listening, and appreciate all you guys, and hope you're doing super well. And if you have any questions, please give us a shout.